The maxillary incisors are 4 in number, 2 central incisors and 2 lateral incisors. In this video, we will focus on the maxillary permanent central incisor. The maxillary central incisors are centered in the maxilla, one on either side of the medial line. The maxillary and mandibular central incisors are the only teeth with their mesial surfaces in contact with each other. The 2 maxillary centrals are bordered distally by the 2 maxillary second or lateral incisors. The major function of the incisors is to incise or cut the food during mastication. In addition, they play important roles in supporting the lips and maintaining a desirable aesthetic appearance. The maxillary central incisors are by far the most important teeth when it comes to aesthetics. Within cosmetic dentistry, the term incisal or central dominance is commonly used to describe the aesthetic significance of the 2 maxillary centrals. They also play a crucial role in speech and phonetics. In the Palmer notation system, the maxillary right and left central incisors are upper right tooth number 1 and upper left tooth number 2. In the universal numbering system, they are tooth number 8 and tooth number 9, and in the international or the FDI numbering system, they are tooth number 1-1 and tooth number 2-1. All anterior teeth develop from 4 developmental lobes. 3 of them are labial lobes, a distofacial lobe, a centrofacial lobe, and a mesiofacial lobe, and the 4th lobe is located lingually, represented by the cingulum. The first sign of calcification is around 3 to 4 months old. Eruption is usually at 7 to 8 years old, and root completion is usually at 10 years old. From the facial or the labial view, the maxillary central incisor appears to have a trapezoidal shape, with a larger base incisally and the narrower base cervically, so the crown appears to be tapered toward the cervix. The maxillary central incisor is the widest anterior tooth mesiodistally. It is also taller incisor-cervically than it is mesiodistally, although sometimes this might not be the case and they can be a bit more similar, and thus the crown appears to have a more squarish shape. The mesial outline is straight, with a crest of curvature or the height of contour being in the incisal third. The mesio-incisor angle is a right angle and is quite sharp. On the other hand, the distal outline is more convex than the mesial outline, with the crest of curvature being at the junction between the middle and incisal thirds of the crown, and the distal incisor angle is more curved than the sharper mesio-incisor angle. Unlike canines, premolars, and molars, incisors have incisal ridges and edges rather than cusps. An incisal ridge is that portion of the crown that makes up the complete incisal portion, while the term incisal edge is used when an angle is formed by the incisal wear, creating a flattened surface linguo-incisally. Each one of the 3 labial lobes we have mentioned earlier terminates incisally in rounded eminences or bumps known as mamelons. These mamelons are prominent in newly erupted incisors. Occlusal wear will reduce the mamelons and create the incisal edge, that is, unless the tooth is misaligned and escapes incisal wear, so in most adults the incisal outline appears to be fairly straight. Maxillary central incisors often do show traces of the fusion of the 3 labial lobes on the labial surface by visible markings in the enamel called developmental grooves or depressions. The facial aspect is usually very flat, except for the incisal third, which is a little bit more convex. The cervical outline of the crown follows a semicircular direction, with the curvature directed towards the root. There are also ridges called the pericomata on the incisal third of the crown, near the gum line. The grooves between these ridges are called imbrication lines. They are usually not that prominent, and they are most visible on the maxillary central incisor. Looking at the maxillary central incisor from the palatal aspect, the tooth appears to be narrower than the facial or the labial aspect. The outline is the same as that of the facial view, only in reverse. However, compared to the facial surface, which is fairly flat, the surface of the palatal aspect is a lot more irregular. We can notice a fairly large depression called the lingual fossa that is bordered by the mesial marginal ridge, the distal marginal ridge, the incisal ridge or the linguo-incisal edge, and the cingulum. Sometimes there is a developmental groove from the cingulum to the fossa. Both facial and lingual cervical lines are convex towards the apex, but on the lingual aspect, it is a bit more pronounced. Now let's take a look at the tooth from the proximal view. From a side view, the crown of the maxillary central incisor appears to be wedge-shaped or triangular. This triangle is tapered from the CEJ to the incisal edge. A line drawn through the center of the root will bisect the apex of the root as well as the incisal ridge of the crown. The labial outline is slightly convex, while the lingual outline is convex at the cingulum, then concave at the mesial and the distal marginal ridges, then slightly convex at the incisal ridge. The cervical outline curves incisally. This is more pronounced in the mesial aspect than it is on the distal aspect. In fact, the curvature on the mesial aspect of the maxillary central incisor is greater than any surface on any other tooth. From the incisal view, the crown appears in a triangular shape. The mesiodistal width of the labial part is greater than the mesiodistal width of the lingual part. Hence, from the incisal view, the tooth appears to be tapering towards the lingual. Also, the mesiodistal width is larger than the labiolingual length, the widest mesiodistally being at the incisal ridge. The mesial and distal marginal ridges are also visible, so is the slightly distally placed cingulum. Obviously, the central incisor has one root. 100% of central incisors have a single canal. The root of the maxillary central incisor is straight, cone-shaped with a blunt apex, and is taller than the crown. The crown is about 11 mm tall on average, and the root is usually 2 to 3 mm taller. The apex of the root points slightly distally. The pulp chamber shows 3 pulp horns, and a cross-section of the root at the cervix shows a rounded triangle.